Hi, I'm Lyndsey,
And I'm Dawn.
and today we're going to be talking about the role of occupational therapy with patients who have Alzheimer's disease.
We hope you enjoy our presentation. Alzheimer's disease is an irreversible dementia that is marked by a progressive loss of memory and cognitive function that eventually prevents the ability to carry out simple tasks of daily living. It is a regressive disease, which means that dementia symptoms gradually worsen over time, making it harder for people who suffer from the disease to maintain their independence in daily living, work, leisure, and social participation. The causes are unknown at this time, but the risk of AD increases with age. The research shows that symptoms start showing after 60 years of age, and the population of people with AD is predicted to double every 20 years and to increase to more than 80 million by 2040. Care for people with dementia is extremely resource demanding, and approximately 70% of people with AD are cared for by friends and family at home. There is no cure or effective treatment for AD at this time, although there is some evidence showing that purposeful activity delays the onset of dementia. Occupational therapy services for people who have AD and related dementia are provided in settings that range from hospitals, special care units, community centers, and homes. Studies were done to show the effectiveness of intervention to modify activity demands of occupations of self-care and leisure for people with Alzheimer's disease. This study showed to have a positive effect and concentrated on 4 practice principles. 1. Occupational therapy programs should be individualized to elicit the person's highest level of retained skills and interests. 2. Short and clear cues should be used while assisting people with AD to complete tasks. 3. Environmental modifications and simple adaptive equipment should be specifically implemented on the unique needs of the person. 4. And lastly, caregiver training and involvement are essential to individualized programs. For clarification, activity demands are the specific features of an activity that influence the type and amount of effort required to perform an activity. For example, the activity of making a phone call demands the number to be called, a telephone, a finger to dial, and a clear voice. Results of the first principle of the individualization to match activities to the patient's current cognitive and physical disabilities show to maintain their independence longer and even regain some lost function. This approach also caught the person's interest, as well as reduced dementia-related behaviors such as wandering, screaming, and physical aggression. Results in the second practice principle in verbal cues, reinforcements, and reality orientation cues also suggested a positive effect on people with Alzheimer's disease. All cues were used to match the person's level of cognition and range from neutral statements like, "It's the beginning of the day," to direct statements like, "Put this sock on your left foot." Occupational therapists had the choice to pair the cues with gestures like pointing at the item or physical prompts like touching the person's left foot while stating, "Put the sock on your left foot." Cues were frequently accompanied by reinforcements like, "That's right, good job," when tasks were completed. Activities were also suggested to be broken down into segments for more cognitively impaired people, and cues for higher function patients should encourage information processing rather than factual knowledge. Like, for example, instead of telling the person to find the meal preparation items one by one, the therapist should use cues like, "You have bread, so what would you like to put on your sandwich?" Lastly, reality orientation cues in the form of signs or calendars encourage patients to maintain a sense of presence without reinforcing dependence. The third practice principle of environmental modification showed progress towards people with Alzheimer's disease. Directional signs like labeled drawers and cupboards were effective strategies. Organization of workspace with all materials visibly out helped the person complete tasks more independently. Also, keeping a clutter-free room reduced distraction. Adaptive equipment were also effective, but not so dramatically that the person can get confused. Some examples included extended hand grips or grab bars instead of brand new equipment that are not commonly used. Lastly, caregiver training and involvement were effective in maintaining retained skills of people with Alzheimer's. When providing caregiving training and proper cues, it allowed more independence and greater quality of life of patients. This also lowered caregiver burden because the person with AD is more able to participate in activities successfully. As you can see, individualizing interventions for people with Alzheimer's disease can significantly lower the activity demands for people who suffer from Alzheimer's disease. As the prevalence of AD increases, occupational therapists must find more ways to help people who can easily get lost in their everyday activities reach more attainable goals. More research should be done to discover new evidence-based interventions that allow people with Alzheimer's disease live a full and productive life.
Occupational therapy uses an assessment to indicate that Alzheimer's disease or dementia is present. A broad identification tool can be used to identify symptoms. Some examples of questions that could be asked during an assessment could include: does the patient have trouble remembering recent conversations, events, or appointments? Does the patient have trouble following a complex train of thought or performing tasks that require multiple steps? Does the patient have increased difficulty finding words to express what he or she wants to say? There is also a questionnaire that can be distributed to family members and caregivers to indicate their opinion of the client and their abilities or disabilities, and the need for the client to be evaluated further. Occupational therapy utilizes cognitive interventions for patients with Alzheimer's. Sessions are usually private and individual and usually include the caregiver of the client. Occupational therapists use different types of cognitive interventions with these patients, which can be divided into 3 categories: cognitive stimulation, cognitive rehabilitation, and cognitive training. Cognitive stimulation utilizes participation in group, occupationally based activities. Procedural memory function is essential to client participation in activities. Reminiscence therapy is sometimes used to recall and discuss past experiences with the help of a prompt. Evidence has shown that reminiscence therapy has a significantly positive effect on behavior, cognition, and depression in clients with Alzheimer's and dementia. Cognitive rehabilitation is an individual treatment to improve functioning in everyday life. This intervention is most appropriate for those clients who are in the earlier stages of Alzheimer's and are able to recall some memories from their past, and can use this to develop strategies for the memory areas that are weaker. Tools that can be used for this are diaries, agendas, calendars, timers, etc. These cognitive rehabilitation interventions are centered around the client and are geared towards activities or occupations that are important and relevant to each client individually. Some positive effects of cognitive rehabilitation intervention are that clients can learn or relearn information that is meaningful to them in their personal lives. This information can be maintained and used over time in their everyday lives. Cognitive training is an intervention focused on cognitive functions that are trained using a set of tasks. Strategies are taught and practiced through exercises, with the hope being that this practice will maintain or improve function in that area. Some of the strategies that are practiced are vanishing cues, face name association, categorization, and verbal elaboration. The practicing of these strategies provides support in encoding and retrieving information to eventually improve memory functions. Occupational therapists can implement these strategies into an intervention plan to increase participation in daily occupations. In conclusion, the goal of occupational therapists providing all of these types of interventions and intervention plans for clients who have Alzheimer's disease is to improve overall cognitive function and improve patient performance in tasks of daily living, taking their environment into consideration as well.
Occupational therapists' holistic view of the person in regards to their occupations and environment make important contributions in treating cognitive impairments such as those with Alzheimer's disease.
Even though certain interventions have been proven to have an effect on patients with Alzheimer's, further research is needed to estimate the amount of effectiveness as well as to prove the effectiveness of other interventions that have not been fully researched.
Thank you for watching our presentation.